Ed, thanks for joining here. For everybody that is tuning in, Ed is the Chief Digital Officer for Tech Mahindra Health and Life Sciences, which means it sounds like you focus on pharma, providers, payers, all of the things within the digital spectrum on the healthcare side of things, which is amazing. I want to talk about that. And I know recently you wrote a book. I think your most recent book was called Healthcare Digital Transformation: How Consumerism, Technology, and Pandemic Are Accelerating the Future, which sounds like it's done really well. And so I want to talk about that too. And you're writing another book about the patient experience, it sounds like.
Yeah, it's sort of breaking news. It hasn't been officially announced yet, but we can break it here. Yeah, Chris Ross and I, he's a longtime friend, the CIO of the Mayo Clinic. He and I both are two-time cancer survivors, and we decided to write a book about patient experience, but from the point of view, not just what we learned from being a patient ourselves, but also members of C-suite of two pretty amazing organizations. And so we're really excited about it. It'll be launched at HIMSS in 2022. So really excited about it.
Yeah, that's amazing. I'm excited to read that one. I mean, mostly because I think there's, as you know, you've got the C-suite perspective on things and how that's evolved over the last 20, 30 years. Different job now, I think, than it once was. But certainly bringing the patient experience from a firsthand perspective is it's unique to hear those stories come together. So I'm looking forward to that.
Yeah. We hope it's a really effective playbook for not just health systems and hospitals and practices to really transform how they view the patient experience, but also for patients themselves who might not be advocates, because that's one thing, Ethan, you and I have this advantage, and as most of our peers do, is if we do get sick, we know how to sort of navigate, and it's still frustrating. Yeah. Imagine if you didn't have that background, which is 90% of the population. So
sure.
It's really important for them as well. So we want to make sure that everyone has, whether you go to a Mayo Clinic versus a local hospital, community hospital, or a one doc practice, you should have an amazing experience.
Yeah, I think about that a lot, actually. This is a total deviation from the talk track, but I figured that was going to happen in this conversation, and I haven't even asked about the trumpet yet. So, we could go in a totally different direction with a trumpet solo. But I think being in healthcare and for myself, I've been doing this for 20 years ish. And when you talk to folks that are experiencing the challenges in healthcare, and they kind of expect things to fall into place and for people to advocate for them and for them to find the right doctor, and they're disappointed when that's not what happens.
Yeah.
I think that's a pretty normal experience for everybody, including us. We know what to do when we get to that point sometimes, but even for us, when we get sick, you hit a wall at some point and you're like, I give up. Where do I go from here? Are we touching on these subjects in the new book?
Oh, yeah, totally right on. Because imagine we all, I know if we went into stories, we could all tell stories about bad experiences we've had, and we know the system and we know the people. At Cleveland Clinic, when I had major cancer surgery, they forgot to communicate with my wife, and they knew who I was, and not that I should have any special privilege, but there was a heightened awareness that there's a quote unquote member of the family in house, and you still had a bad experience on that aspect of it. The rest of it was beautiful. So nothing negative about the organization, but the fact, just reinforcing your point that even when we know all the potential obstacles and the way the experience should be, it still happens to us. So if it happens to us, it's happening to everyone else. So that's why, the work that you all do and that we're all trying to do together really is important work to make sure people have, a great experience despite their health situation.
Yeah. So, and that resonates with me. I feel like everybody else, we all have our unique experiences, and there are times when things just don't go well. And so it's a lot of it is for us, I think about the technology that we've been implementing for 20 years. I mean, when I first got started in health tech, I was in, the Allscripts world, got into the Epic world, all EMR big implementations. and thinking about how far we've come since then, but still how far we have to go, right? Like, it's not all about technology. It's about an understanding of what it's like to be in the patient's shoes and how to kind of meet them there to deliver not just good care, but the empathy, the human element of care. I've been going through your tweets as of late to make sure we're on the same page, and we're generally thinking about the same things. You're saying them on Twitter more than I am, but I think we probably agree on a lot of this stuff.
Yeah, digital transformation has the ability to rapidly progress us in our ability to deliver high quality, empathetic care, or the opposite. We can screw things up really bad now. So you have to be really wise when it comes to the implementation of such tools and things like that. In the past, if you made a mistake in the manual world, you could identify that and correct it pretty quickly. But in this hyper speedy world that we're in with all these digital tools, now you got to be really careful, because if you don't use them right, you could do more harm than good.
Yeah. So I want to get into, I guess, a space that we play a lot in and we think a lot about, and that is physician practice space. Small, medium size, some large groups, but the last year has been, it's obviously been chaotic, to say the least, but a lot of folks are implementing technology to try to solve problems that they had never thought about before. And I guess my question for you is, and kind of as you think about that 1 doc practice or that 10 doc practice, what does this look like in a year, and how much of this this transition that we've made in the past 12 months, how much of this continues into 2022?
Yeah, I think that's a question, Ethan, everyone's trying to figure out, because we already saw it with virtual visits, right? Where it went up on an average. I kind of take the average of average. I've read several different studies, including government studies, but it went from under 1% to upwards of 70% virtual visits during the height of the pandemic, when we were trying to figure things out, April, May of last year of 2020. And now it's gone down to below 15%. And people are wondering just how much lower it might go, and is it going to stabilize and go back up? I suspect that we've hit the bottom in terms of utilization, and then it'll grow from here as more and more patients and families see the benefit of it, and also the practices. So as you know, it was hard for the practices to turn so quickly, and they did everything they could to embrace the technology, to make sure patients were taken care of. And it was quite fabulous to see. And now everyone's sort of retreating a little bit, figuring out, okay, how do we make this work in the future? How do we make it as smooth and frictionless as possible? We can't, as you know, a lot of practices sort of, as did hospitals, they sort of took the poor processes that they may have had in the past and then made it into a virtual poor process. That's what I was trying to say earlier about the acceleration or de-acceleration. And so I think now we're trying to figure out, okay, this is a new world. We can't think of it in the same way we used to in terms of manual processes, or people come in and sit in a waiting room. Well, they don't want to sit online in the same sort of waiting room, those sort of things. So to answer your question a little bit more succinctly, I think we've hit the bottom in terms of where it's going to stabilize, and then it's going to continue to go up as we learn more and add more capabilities.
Yeah, I think that's a really good point. It seems like we've learned a lot about what works and what doesn't virtually, right? It's you threw this thing into every practice that needed it because they had to solve for this problem, and this was the new way to treat patients, at least temporarily. But it does feel like, depending on specialty, depending on the demographic, depending on the internet connectivity in a certain area of the country, I mean, there's so many variables that impact the success of this moving forward. And so it sounds to me like you're saying, we're going to go to a place where, yes, it's a lot more hybrid than it was before, but it's going to be more informed based on kind of what we learned.
Yeah. And I think you're going to see, Ethan, a lot of hyper-personalization take place, because again, everyone scrambled. And again, it was beautiful how the physician practices responded. And now that there's a little bit of time to sort of settle down and think back through things, I think we're going to see an era of personalization come up. Because if you think about other industries that are particularly good, let's take Starbucks as an example. very personalized. And I think healthcare is going to start gravitating towards that. Of course, Amazon, people throw that out as an example all the time, but we can go more into some examples. But I think there's going to be this era of hyper-personalization. And then, because you're right, what you alluded to was there's not a one size fits all. And some communities just don't have the bandwidth. And we have to remember, again, we are a little different because we work in technology. So of course we're going to have high bandwidth into our homes and things like that. We think that's normal, but it's not. Yeah. And when we did a study in Cleveland, this would have been 2018, wrote a book called Voices of Innovation. And it was really a collection of other people's innovation. And some of the research that was in the book was out of Case Western, which is a university in Cleveland. And they found that 25% of the residents of the city of Cleveland did not have broadband.
Wow.
Now, think about that. I would have never thought of that. If you would have asked me, I would have said, 5%. No, 25%. So when we talk about video and all this kind of stuff, I love it. I embrace it. But I'm telling you, 25% of your patients can't do it. So you've got to be all about personalization and give them lots of choices.
Yeah, that makes sense. So I want to talk about the personalization concept a little bit. I'm a technologist first, and then I'm a healthcare guy. And so I like the apps, and I have always, right? I always had the first iPhone. I always was downloading, the latest apps to come out and thinking about the implications of said consumer app on healthcare. What can we learn from other verticals that have done this thing well? What can we learn from Silicon Valley that has stripped out all the friction in an onboarding process? How can we apply that to the patient portal? Or how can we think about these things differently? Because I don't want to get caught thinking, as I've, 20 years into this now, I don't want to become a healthcare guy that only thinks in terms of healthcare. I want to think about technology and the way it can solve problems in other ways and apply what we've learned to healthcare to solve problems faster and better in healthcare. Is that kind of, you think about personalization, you're looking to outside of healthcare, right? When you think about
yeah. I always do. I know I get some of my peers get mad at me every once in a while, my healthcare peers, when I say we're 5-10 years behind other industries, but I think we are. The truth is, when we're really gut honest. And so it's really important to look outside of our own industry and see what best practices there might be that we can latch onto and then modify to fit healthcare. So, we always say, everyone says this though, everyone always says, well, healthcare, we're different, we're special. Well, yeah, we are special. And that's why we've all chosen this vocation, because we do feel that way, but we're not that special. There's other, really critical industries as well. So yeah, so I'm always out there looking. And then I think to myself, how can we apply that to healthcare? So an example would be just to know, so some of the concepts, Ethan, I know this and your audience knows this, is a lot of it is just pure good people skill. And then you use technology to sort of, again, scale it, if you will. So one concept is to know me. I want to be known. When I belong to USAA. It's started off as a financial services brokerage for military officers and then expanded into insurance and everything. And they're always rated number 1 and number 2, JD Power's customer satisfaction. So they're pretty legit. They've been around a while. They don't have a bank. I've never, when we talk about banking, okay, so this wasn't the example, but now that I think about it, I've never been into a bank. Okay, I'm in my mid 50s. When I was 20 years old, I became an ROTC cadet, which then gave me rights to belong to USAA. They didn't have a bank. It was all, even back then, it was all online. It was a little bit more kludgy. You had to scan your checks, as an example, with a scanner. And then they got a little, then their technology improved over time, as with everything else. But they made it so convenient. But they knew me all the time. Whenever I'd call Captain Marx, Lieutenant Marx, they knew that I got promoted. They knew, they'd always ask about my family because they had all that information there. They had a CRM, which we're just still thinking about, most healthcare organizations. And so they knew me, and it made me feel special. And by leveraging technology, it made me feel even more special. So, and of course it works to their benefit, because then I become a lifelong, I'll never leave USAA. It's I carry this 30-year sticker now, all that kind of stuff. So there's that loyalty factor, but they know me. So I did an experiment recently on Twitter. You may have seen it, where I said, hey, USA knows me, Marriott knows me, American Airlines knows me, but my healthcare organization, and I listed them, that doesn't know me. And all of them replied, except for my healthcare organization, because they don't know, they're not out there. So they
Yeah.
don't really know me. So anyways, know me and then personalize things to me. So they know that I prefer text message as an example. And people know this with their flying apps, right? I don't want an email from American Airlines telling me my flight is late. I just want a text. And so that's what I mean. They know me. They allow me to have hyper personalization. So those are some other industry, but I have a couple other good ones really quick. Because they're so unique and great thinking. And one is Oreo cookies, right? So if you actually go to Oreo website, you can personalize Oreo. So I live with a bunch of vegans, and vegan apparently for most vegans, Oreo is acceptable as a vegan.
Okay.
Yeah. So you can go on there and then personalize. Like, so I've built Oreos that have the face of my kids on them because they love Oreos. And I picked the certain, like half of it's fudge, half of it's not fudge. You can hyper personalize these things. So we're an Oreo family. We spend so much money on Oreos now, even though we're fairly healthy eaters, So they've got us. They're loyalty every time they come out with a new flavor, Purina dog chow is another good example where, you go to the store, you don't want to commit to like a huge case of liver, dog puppy chow or whatever. Maybe you want a little chicken, maybe a little liver, maybe a little of a vegan. I don't know. So you can go on their site and create that. So that's a hyper personalization. Why don't we do that in healthcare? Ed, we know that you only like holistic medicine. So we're not going to tell you take an aspirin, take a Tylenol. We're going to tell you, hey, there's these things called cocoa leaves or whatever. I'm making this all up on the fly here. But you understand what I'm saying. It's like very personalized. And so I feel like, wow, that practice knows me. My doctor knows me. So yeah.
Yeah, well, okay. So that's a really good point. And we all know the challenges, at least the reimbursement misalignment in the healthcare makes it hard for everybody to do things the same way and feel like they can spend time focused on these things. But I'm assuming that based on the doctors that I know, the ones, OMD works with, or the ones that I've met over time, like they all got into healthcare to provide the best possible care, the best possible experience that they can. And the constraints on that are oftentimes, the technology, it's the reimbursement, the time in the day to do all of these things. And so as we think about continuing to personalize, personalize healthcare and deliver this kind of experience, knowing who you are, Ed, and what it is that you want out of your healthcare experience, I like to think a lot about how we can take what concierge medicine has done, because they've eliminated the reimbursement misalignment, right? They've eliminated this complexity around billing, and they said, here's the dollar amount, and here's what I'm going to do for you, right? How can we give everybody that experience, right? How can we give that kind of like perfect healthcare experience that's built in a way that not everyone has access to it? But how can we give the brick and mortar practices and hospitals the ability to do some of that, to bring people in to work, to personalize the experience? I think that's a great, I think about that a lot. I don't have a concierge doc myself, but everybody I talk to says it's either they have a concierge doc or their dad's a doctor or their mom's a doctor, and they're like, you know what I did? I texted my doctor. I'm like, I want everybody to have that. But yeah, and that's kind of the way we think about things too. It's there's a lot of opportunity, a lot of low-hanging fruit to improve the personalization of care.
Yeah, you don't have to have a huge war chest for investment. You can start with very simple things, and oftentimes the simple things are more impactful than the complex things. Like I know from the work that you all do and what you develop that we talk a lot about digital front doors and portals, and the utilization rate of those is not very high, but people always respond to their text messages as an example. So you just have to, again, understand I'm not saying don't have a portal. I love portals and all that kind of stuff. But give options and personalize it. So for me, it might just be text messages. For someone else, they want to get into that detail and graph their own results and things like that. So you can do both, but definitely you got to start somewhere. And again, it's not like doing just texting is just meant to be minimal, because it has such maximal impact. So you're getting like the best of both worlds.
Yeah, I mean, that's, I probably told you this years ago, when we were talking about Alan Edmonds' shoes at his Tacopalooza. But I think about a lot of this stuff in terms of maximizing the likelihood that you're going to be able to reach someone as a starting point. Like,
Yeah.
what's the most likely channel to reach people? And the data doesn't lie, right? You look to consumer tech and say, okay, well, here's this graph up and to the right on usage of text messaging. It's not magic. The decline of phone calls, the decline of email. We're not inventing
Right.
some magic technology. We're just saying, what do people use? How do we use that too in healthcare to solve for some of these problems? And to your point, when we started this, again, back to like my earlier days on the patient portal side of things, we saw this problem relatively early, just because we were working with so many hospitals and practices implementing the portal. And we just said, great, the portal solves for X, Y, and Z really well. Text is not going to solve for those things.
Yeah.
But does anyone use a portal-like technology in their daily lives for communication? And the answer is no. So let's pull that out and say, okay, like, what's the easier way to do this that people are actually going to appreciate, that people are going to pay attention to? And that's, I sometimes pick on some of the CIOs that I talked to back in the day who I remember one at an EMR vendor event that walked up to our booth, and we were doing a proof of concept for OhMD. This is maybe 2013, 2014. And the CIO walked up and he said, so why would any patient want to text with their doctor? And I said, I guess if you don't see it, you don't see it. And that was the end of that conversation. But it's not magic.
Yeah.
We just have to kind of know where patients are and kind of use the technology that they're already using. Let's not make this harder than it has to be.
Yeah, it's about usability, simplicity. We talked about frictionless, all the buzzwords, seamless. And I'm not just sharing this because we're talking today and I'm your guest, but this is real. This is real. So I do have a concierge doc. He happened to be my PCP doc 10 years ago, and he, for his own reasons, went to the concierge side about 2 years ago. So it was like, hey, we really like our doc, so we're gonna have to bite the bullet. But I wanted to do it anyways because it is sort of a trend, and I wanted to see, hey, what it's like. So yes, I can text with them, and I do. And they also have a portal. And I hate to confess this because people watching this are going to be like horrified, but I've never been on the portal. I've never been on it. It's just because now I'm thinking, man, I had everything on this one portal. I won't mention vendor names. And it's cool, it's easy. But now I've got another portal. And oh my gosh, I don't have time to have another password in a different format. And oh my gosh, it's just too much. So the fact that I could just text them anytime, that's just brilliant. I love it.
Yeah, that's it. So that's a good segue. So relationships, like the patient relationship. This is some potentially a buzzword of the past few years. Maybe it's a future buzzword, but this idea of you said this earlier, a customer relationship management solution. Like every other vendor or every other vertical is using Salesforce for their CRM. Healthcare uses the EMR, the practice management system, neither of which are managing the relationship.
Right.
How important is the relationship as you think about your care as a patient, and where do you think that's going to go?
Yeah, I'm still sort of old school on the relationship aspect. I think it is still critical. And, I love the fact that they know me. I mentioned that earlier, but when I go to the physician office that I've been mentioning, they ask, hey, what's the latest race you were in? Because they know that I'm pretty active. They just know stuff, and nothing that they shouldn't know. It's not like they're creeping or anything, but they pick it up during the conversation. They put it in their notes probably, and they're smart, review those notes, and they know who you are. And they make us feel like really special when we come in the office. They think my wife's a rock star of some sort, and they communicate with her and in methods that she likes. It just reinforces the whole thing. So I think if you did one without the other, it wouldn't be enough. But when you add in sort of the old school relationship techniques plus modernizing it, as we mentioned, to go at scale, it really creates a loyalty and a bond that I don't think you want to break.
Yeah, so that makes sense. And as we think about the physician practice space and the future of that space, what are the challenges for them? Are they better positioned to manage the relationship than the larger organizations, or not so much so? What are your thoughts on that?
Yeah, I do think that's where the rubber meets the road, is the physician practice. And that's where healthcare really means a lot. And that relationship is key. And that's why, when we bring it sort of back to technologies, how do you leverage some technology to enhance that loyalty capability, to enhance that feeling like you're cared for, not just clinically, but as a human being. So yeah, I still think it's really relevant, and more so in the future, as individuals may have more choices in the future. I don't know. That's the hard part, right? Is Amazon Care going to start getting involved? If they're not, maybe someone else is. And as we know, because of technology and different factors going on in healthcare, there's a lot of more choices, I think, for patients and people. And so you need to be sure that, you're providing all these services, again, personalized and empathetically, and also some of the tools that we've been talking about to really keep that patient, have a loyal patient. Because as you know, Ethan, I think about our family, and we still use the same pediatricians. Our kids still go, some of our kids are like in their early 20s, they still go to the pediatrician. I forget what the cutoff age is, but they're in their early 20s. They're still going because they have that bond, and we, still have a relationship there. And my wife has a long time relationship with her OB-GYN, physician. So it really matters. It still matters.
And doesn't that speak to the importance of that longitudinal relationship over time, right? Like I think back to when some of the telehealth companies, the direct to consumer telehealth companies started coming out, and you started looking at kind of early data of, okay, well, what does it look like when I start going to the app for my urgent care, but I'm also, I have an endocrine disorder. So what happens when I do that? And then do I go to a real doctor after to really solve this problem? Yeah. Or, what's the cutoff, and how do you transition between something that's, much more urgent care focused, or at least, that's where they started, to that longitudinal thing? Like, healthcare is complicated. Yeah. And we all have a bunch of stuff going on. And as we get older, that gets more complicated to track. So, I think the longitudinal nature of healthcare is really, it separates us from a lot of the other verticals out there, because we grow over time, we change over time. We need someone to be able to look at that and understand who I am and how I've changed, right?
Yeah. Yeah. And to that point, let's see if I can make this fit, because I haven't thought this through, what I'm about to say. But it reminds me of another example from outside of healthcare. So I had a friend of mine, he developed a marketing campaign for Pampers a few years ago. And he decided to focus on the mother, not the baby. So usually in Pampers commercials or diaper commercials, you see a lot of babies crawling around in diapers, and how much liquid can they absorb, whatever.
Sure.
He focused the campaign, and it was their best campaign to date. He focused their campaign on the mom, because his theory was that the mom has this longitudinal relationship, it doesn't have to be a mom, it could be a dad buying diapers, but I'm just telling you, back then, this was the campaign. So no one gives us angry emails or texts. So focus on the mom and that long-term longitudinal relationship, because if she has a good experience with Pampers, she will start to use that same brand or the company that makes Pampers for all of her needs. And this is where it does differentiate between a male and female, because she'll have different types of needs than the male will for that particular brand. And that's what they did. So they focused on the longitudinal relationship, and they built a loyal customer for 40, 50 years, as opposed to 5 years for a baby, 3 years for a baby. So it's really important to take that point of view, the long term, and then as you add these capabilities, and again, to your point, you were saying, if for some it might be text, but you have additional capabilities that, hey, if they want to do flip onto something else, you can do that as well.
Yeah.
But start where they want to start and roll with them.
Yeah. Yeah. I've said this a few times, probably in different conversations lately, but we do this like healthcare is like field of dreams, right? Like if you build it, they will come. And we think a lot about what we could build. But yeah, I think there's, I'm very hopeful actually about the change that's happening on, whether it's the Amazons or kind of everything, all the catalysts that drive us as kind of brick and mortar practices and hospitals, drive us as a company that supports them to innovate and do things better, because those are the catalysts to change. And it reminds me of, I forget which Hims show it was, where it was the first show that Amazon had a booth, Google had a booth, Apple was there. They didn't have a booth, but everybody knew they were there. And I just remember kind of all the old kind of traditional vendors thinking like, what's this going to go? What direction is this going to go for us? What are we going to have to do to compete with these guys, because they get consumers, right? Yeah. So yeah, it's I think we're at a good point again to do more of that and be forced in a direction to solve for these kind of important pieces of healthcare that we don't solve for that well today.
Yeah, no, I agree with you completely.
If you're talking to a physician practice and they're thinking about, what do we have to do to compete with, again, it doesn't have to be Amazon, but whoever, to compete with this organization that's going to come into our backyard, like what are the kind of top 2, top 3 things that you would say need to be the focus over the next 5 years?
Think like a digital first company. So if you were trying to disrupt the space, what would you do? And you only have to look at some of the organizations already mentioned, and Amazon, things like that. Yeah. And you can look up who are some of these digital first type companies and start acting like them. So you still have your office like you would, because we're all about hyper-personalization and a lot of patients still want to come in. But now you want to add some additional capabilities like the texting. Again, some of this is pretty low-hanging fruit, not terribly difficult to adopt, and then sort of grow the capabilities from there. And hyper-personalization is also, when I go back now to the old school side, so I'm sharing a couple like old school principles and digital principles. But one of them in hyper-personalization is what's your availability? This one crosses over both. So what's unique about Walmart? Well, they stay open till 9 p.m. It's not 8 to 5. So they're staying open longer, and it could be open virtually longer as well. So think about that. And again, that's why when I say survival of the digitalists, what are they doing? What are the digital first companies doing? Well, they're really convenient. You can come in, or you can go online, and you can work with them, see them, however it is that you want. So a sort of scale up, if you will. So those are 2 or 3 things right off the bat that you can do: the mind shift change, the digital first orientation, and then start scaling the solutions and start really simple and work your way up to the extent that that's what your patients want.
Yeah. Okay. That makes sense. And so on the other side of things, we're not calling anyone out, of course, but are there experiences that you've had or you've seen where it's just like, stop doing this thing in private practice? Like, don't do that anymore. That's not going to help you.
Well, I think the waiting rooms should be a thing of the past. It's just such a horrid experience. And I think we really can leverage, the pandemic in a positive way to say, hey, let's eliminate waiting rooms and just text me when I'm within 15 minutes of my appointment, or whatever time I tell you in the system, like text me 30 minutes in advance or 15. So I think things like that would be helpful. So I just can't stand waiting for care. And again, that's not seamless. It's not customer service oriented, those sort of things. Make it easy for me to interact. So I've run into situations where it was really hard for me to reach the clinician afterwards. Like, you always have that question, or, I'm about to go on this big hike, Inca Trail. And
oh, wow,
I forgot to ask for Diamox, so to help with altitude. And in a traditional environment, I would have to call, have to try to, maybe book an appointment. And I didn't want to do that, but, now I can text. Hey, sorry, doc, I forgot Diamox. Can you send that over to my pharmacy. And he's like, yeah, of course, it's done. So things like that, being really responsive, customer oriented, and give me the tools. Again, it doesn't have to be sophisticated. In fact, as we've said a couple of times now, a lot of times the less sophisticated tools are the ones that are used the most and appreciated the most. So give me some tools that I can use to really automate the experience.
Yeah. And how do you say you implement some of these changes and different, and no more waiting room. You can follow up with us about, questions about your prescription. How do you gauge? How do you track or quantify success around the relationship? How would you think about that? I don't have an answer to this. It's interesting to ask that question because I don't necessarily know the best way.
Yeah, I'm always big into measurement, especially when it comes to customer satisfaction and customer service. And when I did my own digital front door on top of an existing patient portal from a vendor, we had an NPS score, a net promoter score. So we would send out surveys and ask, and we had a really good NPS, and we built our KPIs, key performance indicators, around that. Like we're at 90%, we want to get to 91%. So whatever measure you use, it doesn't have to be super sophisticated. It could be as simple as, hey, on a scale of 1 to 5, how was your experience? And then always look to improve it. Like, what can we do to improve the experience? And then I'm always big also into asking your customers, in addition to a survey, but you'd be surprised as a practice if you asked 3 to 5 patients, hey, would you mind having like a focus group, almost 20 minutes. And if it's in person, you buy them donuts or lunch or whatever, or it could all be done virtually on the phone, and just asking for some feedback and then measuring it. I think the other thing too, again, this is sort of old, we're mixing a lot of, because it's not all about digital. So we're mixing a lot of just practical things and digital things. But I think to the extent that the employees feel an ownership stake in the organization, in the practice, it makes a big difference as well. So I don't know the statistics on the physician side, but on dental practice side, it's pretty high. And you can tell the difference. So the dental clinic I go to, they're all own part of the dental clinic. So they're really into service, customer service. And you can tell the difference between, I call it, are you planted or potted? If you think about a flower that's potted, that flower is just there for a short term and you'll enjoy it for a season and it's gone. But when they're planted, it's something, that's there a lot longer, it's vested and it's coming back each year. And so that's really important as well. So I know that's not really a technical thing, digital transformation, but
no, I mean, culture, right? I mean, the culture in a practice is going to shine through if you have a positive culture directly to the patients, and that's what you want.
Yeah, and if you add that, I mean, that's the formula I think that you're just trying to get to is you add those capabilities that any practice can do. It costs zero money. And then you add some of these digital capabilities, you're going to not only survive, but thrive.
Yeah, I totally agree. I think there's this, we really have a hard time taking a step out of the day-to-day grind, and the phones are ringing off the hook and I'm getting too many emails and I have to do, send or update the chart with X, Y, and Z, but we're all patients. And that's what's unique about this. We're not all, in every other vertical, we're not all customers of the service that we're offering, but it's easy in healthcare. If you just take a second to step back and feel what it felt like to call a practice and leave a voicemail and not hear back for 2 days, or just understand what you would want if you were in the shoes of the patient. So I totally get it. I think that's exactly what we're trying to accomplish.
Let me just emphasize that point with one story. You were asking earlier about some stories, and here's a simple one where text messaging could have been the perfect solution. But I had this pretty serious surgery, and it went longer than they anticipated. So my wife's thinking 3 hours waiting in a waiting room, and it's going 5 hours, and no one's communicating with her. And she's pretty smart. She's getting her DNP, her doctor of nurse practice. And so she's been a nurse for a long time. And she's thinking there must be something going wrong because the surgery is only supposed to take 3 hours. And then they wouldn't let her into they finally, someone came out and told her that surgery was okay. And I was in not the waiting room, but a recovery room. And the nurse there didn't know what to do. So there was no communication, like to let my wife come in as I woke up and all that kind of stuff. And then they lost me, going to my floor. They lost me. And so it was probably like a 7-hour ordeal. And my wife, she's very assertive. And so, that all could have been solved with some texting, really simple.
Yeah.
Hey, Ed, I mean, not Ed, but Simran, your husband is in the OR and it's going a little while longer. There's nothing wrong. It was just, ran into some scar tissue we didn't anticipate. And then Ed's in the recovery room. And I know we're talking mostly physician practices, but it's the same concept. Or if the practice is at an ambulatory surgery center, same sort of thing. It's like that communication is so key. And then, again, it brings a sense of loyalty and, that you'll never want to leave that physician because you're so bonded and connected.
Yeah, well, healthcare, as you were saying that, I was thinking about how timing and feeling like no one is paying attention or no one cares is such a big part of this experience, unfortunately, right? It's the waiting for my lab results and I'm freaking out because lab results, what are they going to show? Or I'm waiting for, to find out what's going on in the surgery that's taking too long. It's the non-communication, for me at least, that ends up being pretty painful. Like that's where the struggle is. And so I think, and I'm just kind of connecting the dots here, like communication is just such an important part, obviously, of anything, but certainly of healthcare, if nothing else. We should be able to communicate with our patients.
Totally. Yeah, that's just like the baseline now.
Yeah.
Table stakes.
Yep, that's what it feels like. So, I mean, this has been fantastic catching up with you. I'm ready now for the trumpet solo. Whatever you want to play. We didn't prepare for this, but no, I'm really glad you're doing well. I'm really glad we got a chance to catch up. This has been a lot of fun. So would love to do it again sometime.
Yeah, thanks for having me, Ethan. You're doing fantastic things for the industry and helping clinicians. And so, I mean, keep up the great work. I love what you all do, and it's really fascinating. So again, thanks for having me on your show.
Yeah, well, thank you so much for coming.